And joining us now to talk about teens being able to get this COVID-19 vaccine is the Director of the Arizona Department of Health Services, who has been with us throughout this entire pandemic and working very hard, Dr. Cara Christ. Hi, Dr. Christ. Always great to see you. Are you pretty excited now that we can roll out this vaccine to the kids?
Yes, we are very excited that starting today we're able to offer the Pfizer vaccine at all of our state and some of our pharmacy sites to those 12 to 15 years old.
Okay, so we just mentioned there are 400,000 people in that age group now here in Arizona. How many of them, what percentage do you think are going to get this vaccine? And how's it running with adults?
We would be excited if we could get 50% of that population vaccinated. There's about 400,000, like you said. So as we're looking at adults, right now we've got about 42% of our entire population. So that includes the kiddos who aren't eligible yet. So every age group we add and the more people that get vaccinated are going to get us closer to our goal of herd immunity.
What are some of the questions you and your staff are getting about the safety of this vaccine for these younger folks, these 12 to 15-year-old children?
So we are getting questions about the safety and what was done. It's the same dose that adults are receiving. This vaccine has undergone the same clinical trials for safety and efficacy that it did in adults. It has been tested in this age group. The data looks really good. It is just as effective and just as safe as it is for our adult population.
So let me ask you this, and when we look at our overall numbers, and you report the numbers every day there, the Department of Health Services does, it appears like we've reached some sort of a plateau. There were about 600 to maybe 800 cases a day that we're seeing 24 hours. The deaths are slowly creeping down. Are you satisfied with how those numbers are going, or could we do better?
You know, we'd like to see those numbers continue to decrease. We're happy with the plateau right now, considering where we were in January and February. The more Arizonans we can get vaccinated in our community is going to prevent the spread of COVID-19 and continue to reduce those cases. So we're very pleased with where we are with the vaccination, but even with that, we've hit a plateau. So opening up this age group, we think, is really going to help.
What have you heard are the main factors keeping more people from getting vaccinated?
You know, some of the things that we've heard are just the fears about the safety and efficacy, and we've been trying to get the message out that this is safe. It is very, very effective in preventing hospitalization and death, which is really good because we saw we had a lot of that during both waves. And what we're trying to do is also make it more convenient. So it's never been easier to access vaccine than it is right now in Arizona. You can find it in pharmacies, pop-up clinics, state sites, community events. There's a lot of different places to go get the vaccine that will just be a very easy part of your day.
I noticed obviously that you're wearing a mask this morning. Do you recommend, and you're outside, do you recommend people wear masks outside at this point? I mean, is this what you do every day?
So I do wear a mask. I'm always with people that I don't live with. I don't know their vaccination status. I am fully vaccinated. However, I have 3 school-aged children that are in school every day. They are unvaccinated because only one of them just became eligible today to do that. I don't want to pass it on to others. And so
I guess it's not the birthday.
That's why I wear it.
You got a 12-year-old, I get it. And let me ask you one more question about this, because I live in a building and I'm fully vaccinated and have been now for I think about a month. Everything's been done. Is it important for me to wear a mask? Is there science out there that shows that I can still pass on this virus even though I'm fully vaccinated? Because it doesn't make sense to me. If my body now has antibodies that will fight the virus if it gets inside of me, how would I be able then to spread it?
So we know that there's no vaccine that's 100% effective. So while you got vaccinated, you may still become infected, but it would likely be either an asymptomatic case or very, very mild. What we don't know is whether or not you can transmit that to others who have been unvaccinated. So that's why we're still recommending, until we get a little bit more of the community vaccinated, that people wear masks when they're around those that they don't live with.
Right. So we don't know for sure whether or not you can pass it. There's no science saying for sure you can pass it. There's no science saying for sure you're not going to pass it.
Right, but we do know that we've got cases, breakthrough cases, of people who have been fully vaccinated who have had very mild or asymptomatic cases. So we just want to make sure we're protecting those that are still vulnerable in our community and haven't gotten the chance to get vaccinated yet.
Dr. Cara Christ, as always, thank you for everything you and your team are doing and have done through this pandemic. And it seems like the rollout of this vaccine has been just about as good as it could be. And now it's available to everybody. No appointments needed. Thanks again, Dr. Christ, for being on this morning.